Hello and welcome. I'm Dr. Lakshmi and you're watching the Health Talk session by Yashoda Hospitals. In this digital tech-driven world with smartphones, digital TVs and iPads all around, children are spending more time in front of the screens than ever before. So how much TV is good for the children and what impact does it really have on one's health? So let's discuss about screen time and its effects in our today's episode. Dr. Suresh Kumar Panuganti, consultant pediatrician from Yashoda Hospitals, Somajiguda, will be joining us. Welcome to the program, Doctor.
Hello.
So, Doctor, screen time is now an official word in the dictionary. So, what do we mean by screen time?
It's the total amount of the time spent per day on the digital devices, be it television or laptop or a tablet or phone or any video games. The total amount spent per day is called as screen time.
We know that children have easy access to screen now more than ever. But how does screen time affect the early childhood development?
Excessive screen time has effect on physical health, mental health, psychological health as well. To begin with physical health, excessive screen time causes something called digital eye strain. That is pain behind the eyes associated with the neck pain. It can be associated with refractive errors, that is visual disturbances can happen. Coming to the mental health, children have sleep disturbances because of which it increases aggression, it increases violence, and children can have increased temper tantrums. And coming to the psychological behavior, because of withdrawal from the social activities like interaction with other kids and spending more time on the screen, it tends to have social withdrawal and then psychosocial effects, and it can also impact the developing brain specifically, because first 2 years is supposed to be the period when 80% of the brain develops. During this period, if children are deprived of social interaction and are exposed to excessive screen time, their brain development is affected. It can lead to speech delay and other speech disorders.
So apart from these issues, Doctor, how does screen time impact a child's ability to learn, affect language and communication?
Definitely. COVID is a perfect example for that. So during COVID, most children have been exposed to screen both for academic as well as non-academic purposes, during which we have seen speech delay, hearing impairment, and language development was significantly affected. And also, if the child is exposed to a different accent during the screen time, it's much easier for the child to understand and follow that accent, which might not be native to the place where child is living.
So we know it's impossible to keep the children away from the tech gadgets. So what age do you think is appropriate to introduce the screens to the children?
First 2 years, child should be absolutely away from the screen for whatever reasons. Exception might be exposing the child to some video calls with close relatives or siblings or cousins. Other than that, child should not have any kind of exposure less than 2 years. And between 2 to 6 years, graded exposure to television, again it has to be supervised, and preferably it should be for educational purposes. If the whole family sits together, supervises and then encourages the child to learn certain things which are being displayed on the screen, it will be beneficial. And beyond 6 years, probably they can be exposed to a smaller tablet kind of device. Again, it should be for educational purposes. In adolescence, it might be better for the parents themselves to introduce the smartphone, because in this current generation, information is wealth. They might be able to use it for academic purposes as well as some useful purposes like using the Google Maps or learning purposes for school based projects.
So doctor, we've discussed about the appropriate age to introduce screen time to children. So what is considered as an acceptable level of screen time per day?
Like we discussed, less than 2 years it should be nearly zero screen time, and between 2 to 6 years 30 to 60 minutes is the ideal screen time, and again lesser the better. And beyond 6 years, depending on the projects and depending on the academic needs of usage of screen time, probably 60 to 120 minutes, and it should not be beyond this. When we say 60 to 120 minutes, that should include both academic as well as non-academic activities. Again, during this it's better to maintain a certain distance between the screen and the child, because the closer the distance between the screen and the child, higher are the chances that the child is going to have a strain on his eyes, neck, thereby leading to certain physical problems.
So in general, doctor, how addictive can screen time be to kids, and should this be a serious concern?
It can be very addictive, especially if it is not supervised. It depends on the kind of content which they are using, and of late we are seeing most kids getting addicted to video games, especially augmented reality, virtual reality games. We keep seeing in the media as well children committing suicide as well. So it's essential that the parents monitor what the child is seeing. It might not always be possible to ensure the parental control, but if we can help the children understand the benefits and the disadvantages of it, it's going to be useful.
So we've discussed about all the issues a child could be having with excessive screen time. But doctor, on the other side, do you think there are any advantages as well?
Definitely. There are some advantages of using digital devices in this digital era. Especially a child who is shy, he might be able to develop some communication skills because he is not facing the other person in front of his eyes, and it helps in learning certain things for projects. And like I said, information is wealth. You have access to information at your fingertips. So if at all you need something which is related to the academic purposes, obviously spending some time on screen in an appropriate way will help them learn things which are distant and which are not easily available in the libraries or books.
So doctor, in your clinical experience, what kind of issues do you see children facing because of excessive screen time? I mean, do you think really parents complain about this?
Over last few years, we have definitely seen an increase in autism or autism spectrum disorder. We can't completely blame the screen time, but that plays a major role. During COVID, everybody were exposed to screen for various reasons, because parents were working from home and the kids had to be entertained or kept occupied, so they were allowed to use excessive screen. So we have seen children coming with delayed language development, hearing issues, and psychosocial effects, withdrawal of social behavior. So overall we have seen something which we can term as reversible autism spectrum disorder. It's not definitely autism, but once the child is taken away from the screen, they tend to develop their social skills which were lost. Again, if this derangement in the behavior occurs very early in life, that is less than 2 years of age, it might not always be possible to get the child's skills back.
Yeah, I think it's time we consider this as a serious problem and take appropriate measures to tackle this. So before ending this episode, doctor, what tips do you have for parents as far as screen time for kids is concerned?
So introduce the screen time in an age appropriate manner. Less than 2 years, absolutely no screen, and 2 to 6 years, introduce the screen in a graded manner and keep a safe distance while the child is watching the screen, and ensure parental control is there. Whenever it's possible, let the whole family sit together and then watch the screen, so that you have a supervision of what the child is seeing, and anything in excess is poison. Similarly, excess screen time is also poisonous for child's physical, mental and psychosocial health. So keep in limit, keep it safe. Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic screen time and its effects on children, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.